Hey there, everyone, and welcome back to another episode of We Should Talk. I am Megan Walsh here with Amber Trejo, and we are really excited to dive into this week's session. So I'm curious, have you ever sat through an awkward first session with a therapist and just known that it wasn't going to work? Well, Amber has, and this week she is taking us behind the scenes of what it is actually like to go consultation call shopping for a new therapist, red flags and all. Meanwhile, I talk about my experience of having the same therapist for 17 years. We have a really, really interesting conversation about this. So wherever you fit on the spectrum, there will be something for you here. And in this episode, we get real about what makes a therapeutic relationship actually work, the good fits, the bad fits, and everything in between. Plus, we're going to talk a little bit about more unconventional approaches like music psychotherapy. And if you've ever wondered if your therapist is really the one, or felt like starting over with someone new is just too vulnerable to face, this episode is for you. So let's dive in. Hello.
Hello. We're back. Welcome back to We Should Talk. Amber and Megan.
Here we are. This is episode 5, right?
Yeah, episode 5.
I love it.
We're learning so much. At least I'm learning so much, I feel like.
What would you say you've learned the most so far?
Well, it's definitely been interesting watching my face in the episodes. Yes. I'm like, oh, wow, okay. I need to work on that a little bit.
Sure.
Did that happen for you when you first watched through your episodes? When you did your first podcast?
Yes, for sure. And I know I told you this at some point, how I would get comments around like you're saying and and like doing all like this too much. So definitely have learned a lot. That's for sure. But then also like I notice now, like I really emphasize the head nods when we were chatting with watching the episode, chatting with Nick. A lot of head nods and less verbal affirmations. But
yes, something so I'm realizing is just my expressions. Like I've always been told I'm super animated, so I'll either just be like resting bitch face, or I'll be like, "What's going on?" Or I'm just like, "Yep," and I'm like, "What are you doing? Like, stop it!" So I think that's been interesting, just to because you don't pay attention to that stuff. Right. And I wonder if it's actually going to help me show up better in the therapy room, because I wonder if my clients are like, what's going on with this woman's face?
Sure. Right now? Like my favorite moments are when clients call me out of like, wait, that look that you just gave. Right. And we have to take a minute to process it, because our facial expressions communicate so much.
Yes. And I'm totally not like a blank slate therapist by any means. I'm always like, oh, bitch said what?
I love it. And this is such a good intro into I know what we want to talk about today, which is therapy. What it is like to be, to have a therapist, and good therapy experiences, bad therapy experiences, our own as clients. So I love that we're going to bring that in today. So exciting.
Yes, I'm so interested to hear about your experience with therapy, because when I saw that you had your therapist for 17 years, I was a little bit envious of that. I was like, wow, that is so something I long for. And I imagine so many of our listeners feel the same way, because it's rare to be able to find a really good therapist who also becomes someone who walks with you through the transitions of life. And I think it's so important to talk about.
Totally. I'm so excited to talk about this, because I think we will be able to represent the spectrum of experiences, that is for sure, as both therapist and client, without a doubt. But before we dive into that, let's do a little catch up. So what's been going on?
Thinking of this episode, this week I have been trying to find a new therapist, and I have done some consultations with different therapists. It's been a harder week. Last week was a really hard week. I had mentioned before our in-laws moving in and my father-in-law having dementia, and it's just really taken a toll on our family system. It's a totally different world having this whole other situation on top of the day-to-day life stressors. And so something I've noticed, how you had mentioned your anxious attachment coming up when you thought about the book, or when your editor didn't respond like right away. And I feel like what happened to me this last week, I started noticing some more of my complex post-traumatic stress
Mm,
disorder symptoms coming up. So a lot of extreme dysregulation, which I'm like, whoa, really brought to mind how far I've come. Cause I was like, wow, I haven't had any of these in forever.
right.
And they're popping up because I'm in a new situation that I really don't know how to navigate.
Uh-huh.
And I don't feel like I have the capacity for it. And I don't know how to like help myself have the capacity for it.
Yeah. Yeah.
So I
Oh
think
my
just
goodness.
such a good reminder that you can feel like you've come a long way. And then all of a sudden you have one of those moments. And I really had to go back in and tend to myself in that moment.
Yeah. Oh, I can only imagine. I mean, especially this you being put because like our circumstances tend to obviously bring up these old old patterns and feelings that we've worked so hard on, but the fact that you've become like in the kid role again, that you are like living in a home with parents and
Yeah,
how that like again it's different, right? It's different than when you grew up, but you're in that ecosystem and there are
absolutely.
expectations on you, I am
Mhm.
sure many given the
Mhm.
circumstances, and to be in the sandwich part of parenting three boys
Mhm.
and then taking care of your father-in-law, it's so much.
Yeah,
Oh,
yeah, and I think just seeing somebody you love deteriorate from this disease, and my father-in-law, he's like my dad. You know what I mean? And that
yeah.
is one beautiful part of the relationship with my husband and I is that like I am close with my in-laws. He really did take on a fatherly role, especially me not
Yeah.
having a dad. And so it is still like really triggering to some of those attachment systems inside of me, which has been bringing out a different level of those symptoms. And
Mhm.
it's very interesting because it always shows up. So I have really bad eczema.
Mm.
And I was really nervous to do today's podcast because when I start going back into those like emotional flashbacks of childhood or those years and the attachment stuff starts getting triggered, my eczema will flare and I'll always get dermatitis around my mouth. And it's so crazy
Yes.
because it's like so weird how the body remembers. So
Uh-huh.
ever since last week, my dermatitis has been like breaking out all of a sudden and I'm just like itching.
Hmm.
And so yeah, so I've been a little bit of a mess this past
Yes.
week and just
Oh,
trying to find I had just wrapped up with my therapist about 6 months ago and felt like I was in a good place. We had been working together for a year and I was like,
okay.
you know what? I'm gonna take a break. I feel good. And then like all of this stuff has started happening.
Happen.
So now I'm kind of in this place where I'm like, okay, I want to find another therapist because I didn't
Yeah.
feel like that was like my forever therapist.
Okay. Right. Yeah. That was
Which
yeah, gonna
I'm
be my
curious if
question.
anybody feels like that. So just on that journey this week of trying
Yeah.
to find one.
Oh,
And so it really got me thinking about you and your post. And I was like,
yes.
yeah,
Yeah. Yeah. What about this, your most recent therapist, made it feel like they were not the forever therapist?
that's such a good question.
Okay.
She was very nice and she did a really good job of helping me with a lot of different things that I wanted to work on. But I didn't feel like she grasped CPTSD very well. And I think it's
Yeah.
really hard for me when someone doesn't grasp CPTSD and they tell me to
Yeah.
do something that's just like not realistic, of the
Yeah.
situation.
Right.
And so I think that's even like an additional barrier for me is just the whole somebody not understanding and me knowing so much about it makes it harder
Yeah.
to
Oh
find somebody
gosh.
that's a good fit.
To trust
Um,
too, right? Like,
yes. Yeah.
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 Oh,
And so I think that some of the stuff that I was working on and some of her own life circumstances, it just didn't go super well together. And
together.
there were multiple things that I was kind of, I don't love this, but
Yeah.
she's good and she's helping me in this area. So I'm going to stick with this.
Sure.
But after a year and I was like doing okay, I was like, you know what? I'm just going to pause and
Hmm.
just wait. And then I'll kind of get back into it and I'll look for another therapist
Yeah.
down the road.
Sure.
Yeah.
Okay. Okay. Which I think is so important, I think, to highlight for everybody that, again, not every therapist is going to be the right fit. And you have to, because therapy is inherently relational and it's like the quality of the relationship that's going to determine the quality of the work and the growth that
Mhm.
happens. And so even just that element of like, I don't trust that you get me or that you get what CPTSD and what I've been through, just that in itself makes it so
Mhm.
hard for you to like fully relax, into the relationship
Yes.
and to feel super
Yes.
cared for because you're questioning, can you care for me? I don't know if you know, right? Like,
Yes,
so that
absolutely. And I
has a
think
big impact.
that's already a hard thing to do, to just
Yeah,
like open up to somebody.
of
I'm sure so many
course.
listeners can relate to that, right? Like it's so
Hmm.
hard to be able to just like take a breath and trust I can be held here. Like I can be held in this
Yes,
container. And I
I
just guess I
know.
never fully felt that in that year.
Yeah.
So it's kind of like, you know what? I think it's okay to move on.
Yeah. Yeah. You have to listen to yourself. And
Yeah.
so I know you've done some consultation calls. How have you felt? How have you felt on the client side of those?
Like Megan, oh my gosh, it's been hard. I don't know. Like
Yeah.
I want to find a good therapist so bad, but I
Yeah.
also don't want to jump in again. I've
Sure.
probably had five throughout. I've been in therapy consistently for 8 years
Uh-huh.
and I've had five different therapists. So
Wow.
I've never found one that I was just like, this is
Yeah.
my,
This is it.
my therapist. Yeah.
Mm-hmm.
And they've all brought different things that have helped a lot. And I think that's another important point to name is
Mm-hmm.
just that just because they're not the perfect therapist for you and you don't see yourself being with them for multiple years doesn't mean they're not going to help you through a certain piece that you need
Totally.
to get through
Right.
or help you like learn something in the season that you're in. And so I
Yeah.
feel like each of them have moved the needle forward and been helpful for me in so many
Mm-hmm.
different ways.
Yeah.
And it's hard. And I think the consultation calls, whew, I don't know. It's like I feel bad. I'm like, I want to like you. I want to be
Oh,
like,
you want
yeah, this
to.
is the therapist for me. But then I'm like, I didn't like the way they were doing this, or
Right.
I don't know if we're gonna click on a human level. And
Mm-hmm.
so it just
Sure.
it's hard doing those consultation calls
Yeah, I bet. Oh,
and
I can only
awkward.
imagine. Yeah. I mean, especially again, being a therapist on the client side, like it's gotta be again so hard. So
Yeah.
like you really I know I'm sure you're looking for a very special type of person, right? Who can meet you where you are in your work as a therapist and still bring a sense of comfort and relief that they've got it, right? That they've got it. And so oh, this is so hard. Such a hard
Yeah,
process.
I also feel like I need a therapist who's really nurturing. And I feel like
Yes.
that's in our fields,
Uh-huh.
something that a lot of people are kind of like, I'm not going to nurture my client. I'm not going to
Oh,
be that. When I do work with clients, I see myself as a surrogate attachment figure. And Sue Johnson talks
yes.
about that a lot, right? Like
Yes.
we are
Oh yeah.
surrogate attachment figures, especially to those with complex trauma who have such
Uh-huh.
severe attachment injuries. And I
Right.
feel like none of my therapists that I've been with have been like particularly
Mm,
super warm or
warm.
nurturing,
Oh,
which I
okay.
really also want and long for. And that's
Yeah.
what I've been
Yeah.
kind of missing in the consultations.
Okay. Well, that's I mean, good for you for noticing that because I was going to ask like what type of person, right? Because we all need a type of person. Like my therapist is a male, and actually, like I needed that because I have been dealing with a lot of father wounds, and I think why
Yes.
he's been particularly so like aligned for me for so long is because he's a warm, nurturing male. Like it just is just so integral to
Yes.
my process to have that. So of course, like, and again, like that's like the inherent relational component that is the healing part of the relationship, especially if the wound lies in not having the most attuned, nurturing, warm maternal or paternal figure. And that why it's so yeah, it's so important and it's so hard because of course, like I'm sure how anybody finds a therapist, whether it's on Instagram or Psychology Today or wherever you're finding them, it's hard to fully see do they have that quality. And so you do have to like date around and right
Mm,
have these
yeah.
calls to see again how does it feel to be in your presence, to be in
Yes.
conversation with you.
Yeah. And then I feel like you have to give people a grain of take it with a grain of salt because it's like it's your first interaction with them. I know I am always kind
Sure.
of nervous when I do my first intake with a
Yeah.
client or a
Sure.
consultation. So it's also kind of like, is this how they really are, or is this
Uh-huh.
because their nerves and
Uh-huh.
or if I want somebody with some lived experience. I'm like, well, if they do have a lot of complex and attachment trauma, then maybe that's how they present at first, you know? So I feel like it's
Sure.
just all, there's so
Yeah.
many different layers there.
Totally. Totally.
Yeah.
And
Oh, yeah. But
so,
how's your week been going? What's been going on with you? I feel like
oh,
let's lighten it up here a little bit before
sure.
I'm like
Before we dive deeper into
my
this.
dermatitis is itching, everything's off. So let's do something. You got to have something good for
Sure.
us, Megan. Please.
Oh, well, over here we had the 4th of July weekend, which
Oh,
we
that's right. That's right.
spend at we have a family lake house, which is again so lucky and grateful to be able to go to. That's close to Lake Michigan, and so was a fun. The weather was awful. I mean, it's technically in Indiana, so we were in the same state.
Wait, Michigan
And
City? Is that where or
so we're
where's it?
right, Long Beach is like literally right next door to
Oh,
Michigan City.
okay.
Yeah. Yeah,
Okay.
right
There's a
there.
Long Beach, Indiana. Okay, I didn't know that.
Uh-huh. Yeah.
Right.
I'm pretty sure it's an official town. I'm sometimes like the address like says Michigan City, but it at least maybe it is, but the beach portion is Long Beach. So anyway, but it was really nice because my son is very much at this age now. This is like his first summer of like really enjoying like being in the water with his cousins
Oh,
and just being able to really have a blast. So it was fun to like kind of take some time off and just be with him there. Also exhausting, right? It's like it's where like the kind of vacation feeling is so fun, but then you're also like, oh my God, okay, we need to get back to routine.
especially when there's water around. I feel
Oh
like
yeah.
I always loved
Yes.
I loved water with my boys, but I'm also highly anxious around like, oh my gosh, is
Yes.
everything
Oh God.
okay? Is everybody swimming? Like,
Totally.
are we
Yep.
okay?
Are we good? Are we safe? For sure.
Yes.
Yep. I feel
Yeah.
that. That's become my new anxiety dream is actually around like is he okay in the water?
Mm. Yeah.
So totally. So that's kind of what I've been up to and got to do a little work from there too, which was nice, but happy to be back in routine. But my husband just actually left today to go to Boston for the weekend. He's going to see Noah Khan, which is so jealous, with his sisters and at Fenway.
Oh,
Like, oh, so good. So
at
excited for him.
Fenway. Oh
I
my
know,
gosh. That
right?
sounds amazing.
Yeah, so he is very very excited for that, but I chose not to go just given how pregnant I am, just feeling like I'd probably rather stay closer to to home for now, but just feeling more and more pregnant, starting to like really feel I know I probably say this every week, but yeah, feeling the heaviness, right? This kid is growing, that's for sure.
Hmm.
So
Yeah.
so
Are
knowing
you
I got to give
ready? Are you
myself.
ready to see him?
Oh yes, yes,
Oh,
very
his little
excited.
face.
Yeah. Oh my, like it's so like I mean,
Mm.
you've been through this 3 times, but
Yeah.
it's like it's he's gonna look different, right? He's gonna look different from my son, and he's gonna be his
Mhm.
own person, and like I know, like I'm so preparing for that, but so excited to see who he is and what he looks like and what his personality is like. I'm just very excited. Um,
Yes. It's like the
feeling
best blind bag there ever was.
yes, yes. But
Yes.
feeling less prepared, really needing to get the nursery set up, but it's still acting as my husband's office. So we'll get there in the next few weeks or so. But I'm feeling like all right, for me to have the energy to really put my all into getting it together, we're gonna have to hurry it on up to get
Yes.
it
Oh
together.
my
So
goodness. Yes. Pretty
yeah,
soon. Pretty soon.
yeah, pretty soon. So but doing okay. So just taking it easy and yeah, just doing what I can and grateful book wise in July. It's my book's with the copy editor, so I don't really have to do
Mm.
anything until August hits, and then we'll kind of be in one last push of edits before baby gets here. So
Well,
that's where we are.
I know we're taking a break too. Like my workbook is with the copy editor. So my
Okay,
editor's like, you know what? You're not going to have anything major to do until
good.
we get their input back, and then you'll have a few of those edits. And I think that's like in September. So I'm like, I've just been
Okay.
enjoying the break. It's
Yes. Yeah.
nice.
Yeah. Agreed.
Really
Yeah.
nice.
I know. So that's where things are over here this week. And I know we wanted to talk about our best and worst therapy experiences as
Yeah.
clients.
I really want to hear if you're okay with it.
Mm-hmm.
I would love for you to share your experience with your
Yeah,
therapist.
totally.
And I love that you named that about him being a male because I've thought about trying a male therapist. I've never had a male therapist, but a few years ago, I sought out a male chiropractor and a male
Mm-hmm.
massage therapist because I really needed more masculine, safe energy. And
Yes.
that's been so incredibly helpful in healing. And it's another,
Mm-hmm.
aspect of the healing process.
Oh yeah.
And so that's been amazing. But I'm curious for you, just like how your whole therapeutic journey unfolded. Tell me a little bit about that.
Yes. Oh my
And
gosh. Yeah.
yeah,
So excited to share. And actually I write a lot about him in the book too. Which is
that's good.
which is nice. And it was nice to kind of reflect on the journey. But so I met him when I was 19. I was in college. So I went to NYU, and in my undergrad I was making it my own major. I was doing, because I love music. I actually went to school initially for music, was going to do music education, and realized like I don't really want to teach music, but I loved my psychology classes. And so I was like, how can I like mix this somehow? So I was taking music classes, psychology classes, and then I took a class on creative arts therapies. So we went through all of them, like music, art, dance, movement. And he came in to give a uh, presentation, or just help, not a presentation. I'm trying to think of what is the word for like an embodied kind of an experience, a workshop. There we go. We'll go with workshop.
Yes. Yes. That word.
Yeah, a workshop on what it is like to do music psychotherapy work. And I was like, this is fascinating. Like, this feels so like me, and I want to learn more. I want to know more. Like, this feels like exactly what I want to do. And inside of that, that one workshop that he did, he offered, he's like, if you want to do this work, right, it's best to experience the work. And so he said, I'm gonna, if anybody wants to try a session with me, I'm happy to do so. So I was like terrified because I hadn't been to therapy, or maybe at that point I'd maybe seen like the college counselor for a few sessions, but it just didn't really like feel, I don't know, I didn't love it. I didn't have, that was like a not great experience with therapy because it was just verbal, and yeah, I didn't love it so much. So I was like, okay, I'll try it. And then, I go to the first session with him, and again, this is music psychotherapy, which I think it's like everybody has a hard time wrapping their mind around like, what is it? So I like to say, look, you go to, it looks like, and for 90%, right, looks like your average talk therapy session, but to really deepen the work, we bring music in. And so that might mean like improvising together, or doing, any other kind of creative component. But it's a somatic practice, really. It's a way to bring the work into your body, to kind of explore feelings and emotions coming up inside of your body in a way that is, again, deepening it, less intellectualizing, more feeling. And so I remember walking into the first session being like, yeah, like I remember sitting there telling him like everything, like, yeah, my family's fine. Like, it's all good. But like, there's obviously some very glaring things that were not so fine.
Mhm.
And so we did some improvising and music around it. And I was like, whoa. Because so much of it too is like, I like him reflecting, like he might, sing, like reflecting my inner experience. And that has always been like the most powerful thing in our dynamic, where, I might have been hesitant to be like, I feel sad or I feel mad. Like, literally, me saying those words took years. But he could, like, if he's improvising, right, could sing that to me, like as me, right? Could like give voice to my inner world. And it's like,
What? I'm sorry. As you're
yeah.
explaining this to me, I just feel like I've never heard of this type of therapy before. And
Yeah.
it sounds really cool, but it
Yeah.
also, I'm having a hard time imagining it. So
Yes.
can you,
I know.
is it like, can you give
Okay.
me an example?
We'll give an
Okay.
example. Okay. So
Okay.
let's say I go in, I sit down, and let's say in this first session, right, that I had, I'm telling him about like my family system, my family unit. And basically in that he picks up like, ooh, okay, this is a family that really doesn't talk about much there's a lot that's happened, right? There's like a big, at that point, there was a big separation of my parents that happened, but we're not talking about it. I'm explaining different personalities, inside of my family unit. He can obviously see the role that I play in being the quote unquote good daughter. And that is how I show up. So he gets all right. We get all of this information. And so then how it typically goes is, sure, we'll talk about it, but it's always the goal of entering, making, whether it's making music or art, is to just like, let's just play, right? Like, and again, it's a beautiful way to really, that's why I'm so into inner child work, is because when we play, right, again, I'm not thinking about what I'm doing, but I'm just feeling. So for me, actually, as a musician, and like I've spent my whole life singing, and that is what I've always been my thing. Actually, when we make music together in the therapy space, I've always been so avoidant because it's so intimate, right? Like like if you're making
Like you're
music with
just
your
singing
therapist, yeah, I'm like,
yes.
I always will be like, I don't want to. I don't want to do it. But also, like, there's so many times where I'll say that, like, I'm not into it today, and he'll be like, okay, I'll do it, right? I'll make the music. And like, again, what a really beautiful, like, healing reparative moment. So let's say, for example, in that first session, he primarily made the music. Like, he went to the keyboard and started to play, and I can't like fully remember exactly what it was that he said, but he invited me even to just like hum and vocalize with him. Again, the purpose being a somatic experience of literally being able to be vulnerable in that moment and use my voice and make music and notice what I felt in my body. And then for him to be able to sing, right, to just improvise lyrics that just mirrored my inner experience. So it could have been something like, it could have been, I feel grief, I feel sad, I feel confused, because I think, like, right, he's getting the subtext of what I was verbally sharing, right, and again, the healing work being getting into the misattuned parts of my inner world and pulling it out and bringing it into the music. And why it's so effective is because, right, music, it's a safe container, right? It's a safe container. It's why we all are drawn to different songs to pull out different emotions. And so it I know it feels so odd, but it's so incredibly powerful. And of course, this is kind of like, I do this work with clients too, and have trained in the same way as him. But it's just, again, a really cool somatic approach. But it's very hard to verbally talk about because it's like you have to be in it.
No, okay, so as you were telling me that, I started feeling chills. Like I was like,
Yeah.
wow, that seems really powerful. But then there was this other part of me that was like, that just feels like so awkward. Like I would probably start like cracking up, or like,
Yeah.
you know what I mean?
Right.
Like I just, because I
Totally.
was always like a person when I was younger, I would like make up songs or like make up
Yeah.
raps that sound like other raps, but like
Uh-huh.
that was like something that
Yes.
I didn't know for. And so I just,
Wait,
I think
we
there's,
like need to see this part of you.
okay.
Also.
Oh, that I never told you about that. No.
Oh my God. We
Yeah,
need an
so
Amber wrap.
that's like a big thing for me. And
Yeah.
so I'm just thinking to myself, like, I think I could go, and it kind of is similar to any other kind of somatic therapy, right? Like,
Yeah.
and so much of the trauma work that we do, it feels really weird and awkward. And like, that's
Yeah.
a big part of what I do tell my clients is like,
Totally.
lean into the weirdness.
Yeah.
Like
The
you just
weirdness.
gotta imagine yourself of just like, yes, this feels
Yeah.
really weird. This feels really awkward,
Totally. Yeah.
and just kind of let it be,
Yeah.
And
Totally.
so I think that's kind of where it goes for me. Like one part of me is just like, whoa, this is so powerful. Like,
Yeah.
because I've always been someone who's resonated so closely with music and like full goosebumps on songs and used lyrics as my therapy,
Uh-huh. Oh
And
yeah.
so, but then
Yep.
the other part of me of just like, I couldn't imagine being in a room with somebody who
Uh-huh.
I don't know and they're like putting words and like singing,
Uh-huh.
making up a song about what I'm telling them.
Yeah. Yep. Right.
So, how
It's
was that for you in your initial experience? Like, did you feel moved to tears? I'm just like, whoa, he's like really putting it into
I
music.
think not then, because I was still guarded, right? I still was like not
Okay.
letting myself like fully feel everything. But
Hmm.
as we went on, oh my God, yeah, like I still to this day like will,
Mm.
especially in moments where, like, especially since we moved from, because he's based in New York. So once I moved back to Illinois, we've only been virtual in our sessions. Uh, but so it's we've moved into a lot of like it'll be him like right if it, let's say I'm processing grief, right? Like he'll sometimes we'll just he's like, can I play this song for you, right? Like he'll play it and sing it, and even just the act, right? Like the act of him singing a song for me, right? It's like this act of like a lullaby, right? Like this rocking, this cradling, this holding. Like there's so much holding and attunement that happens, right? Especially since I did not grow up with with a father figure who was going to sing me lullabies and for me to feel really safe and held. And so just again like that, so again, it can feel so weird. My therapist is singing to me. And even in moments when I am the one like singing with clients or to clients, right? It is odd, but when you're in it, like it's so intimate, it's so vulnerable. And when, like, if you have attachment trauma, right, where you're like resistant to the intimacy, to the vulnerability, like just that act is just so healing in itself. I've had this really deep trust in him for since I was 19. It's crazy. I'm 36 now. So to have had that for so long, it's wild for him to see me through all of these
Like
chapters of my
so
life.
many big transitions,
Yeah.
you know?
Oh yeah.
And
Yeah.
so many of those like milestone
Yeah.
moments
Oh my
he's walked
gosh.
through with you.
Yeah. Yeah.
Wow.
So really, really special, like a very special relationship. And he's like, what's so great about him too is like he's so laid back. We even like, and we've navigated like our relationship having different hats because the type of music psychotherapy that he does, it's like music therapy itself has like different branches of it. Like some that are what you tend to see like in the media is like a bit more like cognitive behavioral, like
Yeah.
more rehab kind of stuff, and less like New York is kind of the home base of anybody doing more like music psychotherapy work. It's called analytic music therapy. So basically like we go on like a 4-year like deep analytic process on how to do this work in a really relational way. And so and he's like become a trainer in it. And so like I moved into like him being kind of my supervisor in that training. But what is also so great is that the whole time we're also processing like this, moving into this more kind of supervisory relationship, and then obviously still holding space for our therapeutic relationship. Like it all just was integrated. And what that did for me was like release the like, and of course with therapists, right, it's like, oh my god, right, we have to stick to these really intense boundaries and this and ethics, which is true and necessary. But
Yeah.
it also like in a way this like released me from like maybe more of the anxiety and stress I would feel around like keeping a really intense barrier like in sessions with clients, where when that happens you lose the relational, like you lose some of the relational nuances. And so to like
Yeah.
learn how to navigate those with him has helped me so much in learning how to navigate that similarly with my own clients. And it just it
Yes.
really it's just like helped me
Um,
so much in so many ways. So
that's probably been so incredibly healing for you.
yeah, yeah, very much so. I mean, I even like when I got married, I'd have this fantasy of like, I really want him to come. Like, like
Oh, yeah.
I want him to walk me down the aisle, right? Like I would have like,
Oh,
which just
yes.
like, shows like the impact that he's had. Like he has been a really reparative male, father figure to me. And
Yes.
we name that, right? Like we name that's the dynamic that comes up. And of course that's the one that's been really, really healing for me.
Yeah.
So
Well,
yeah.
and I think it's so important to name too, just for anyone listening, that like how that to your nervous system, how reparative that is. So if
Mm-hmm.
we are talking through, our trauma and our attachment wounds, that's one thing. We can know what to do to heal, to make ourselves feel better, to be even to bring ourselves comfort and soothe ourselves. But when we're able to have those pseudo attachment figures, it's or surrogate attachment figures, it teaches our nervous system it's safe. And
Yeah.
so I can only imagine how that's transformed your
Yeah.
nervous system and
I
helped you heal
know.
from that attachment trauma with your dad.
Totally. Totally. It's been pretty awesome. And I still see him like once a month. I'm of course not at a place of meeting every week, but actually when I was going through my miscarriages and the ectopic pregnancy, I saw him more because active grief happening. And so just, it's again, so nice to know that when that happens, yeah, my nervous system knows I have a very safe place to process it. And being able to relax into that for so many years has what is, if we go back to talking about moving from being more anxious to more secure, this is it, right? It's because I've had that experience with him, from that initial fear and having a barrier up and feeling avoidant and resistant to bringing in the more vulnerable parts of me. He's always been the one to say, like, essentially, like, I want you to get mad at me. Like, you're allowed to be angry with me. Like, ugh, duh, I'm not mad at you. Like, I can never be mad at you. But then I was able to like finally have some moments of like, okay, maybe this thing, or, it took me going on maternity leave the first time to realize, like, yeah, you know what, I was kind of jealous of your daughter when he went on maternity leave, right? Of like, feeling like, oh, she's so lucky, right? And able to process that together, that just that dynamic itself, knowing it was safe to do so, has helped me be able to do that, right, in other relationships too. So that's the relational element. We're practicing so much with a safe, really safe person to be able to then kind of copy paste into the real world.
So cool. And do you get to keep the songs? Like, do you ever record any of the songs or any of the music that he's made and then like listen back to? Or how does that work?
I haven't, because usually it is all just like very improvised. Like, and it's nothing that, it might not be anything that we like necessarily do again or return to, but it's more of like a mindfulness kind of practice. So less like structured, like we're creating a verse, of course, this. Like, I would do that when I worked in a hospital with pediatric patients. But for us, it's literally just like, we're just playing, right? We're just like improvising. And then afterwards, just kind of reflecting on like what came up for me in that, right? Like, what did I feel? What did I notice? What shifted? That's kind of how we kind of use it after.
Very cool. And you do that work with clients?
I do, not with everybody, but I have like a handful of long-standing clients where we prioritize bringing music in. And usually when I start to feel stuck with a client, like that's what I go to, of like, okay, let's bring this into the body somehow. Let's put some art to it, or bring in some music. Like, that's always a sign to me of, because we're always going to pull something, right? There's always going to be something to uncover when you bring creativity into it. So
that's cool. I love this. Okay. I feel like, can you do a session with me right now?
Yes.
We should do that as a podcast one time. I would just love that, because I just want to like see what it's like.
Yeah,
you know,
honestly, I want to give you his number. I want you to call it. I tell everybody, like, you need to see. I've said to so many people.
I actually wouldn't mind that. I really wouldn't, but I think I need in person. But I'm also, I don't know. It just, it feels so overwhelming when you haven't, when you have had bad experiences. Right. And I think it's a really common thing for people with complex trauma, that it is just so hard to find a really good therapist that you fully trust. And part of that could be me, you know what I mean? And part of that could be, I don't know. I don't really know. I fully accept that part of it's probably me, though.
Well, yeah, but again, right, there's nothing wrong or bad about that, right? Like, that is just, that's information about what you need. And I feel like inherently there's going to be distrust at the start, of course. But I think you're looking, and I think I would encourage everybody, like, look for those core components that you know that you need. Like, and I think the warmth, right? The warmth, the nurturing feeling, like, we know, honestly, that's probably what you're gonna look for and how you're gonna choose at first, because that is going to be so telling of like how my nervous system is going to feel in your presence, because your nervous system is saying, I want to feel like, right, the warmth and the nurturing vibe is going to show you that you feel safe to step in, to be vulnerable. Versus if someone isn't, that leaves you questioning, do they have their own wounds? Do they have this? Do they have that? Right? It's like these parts of them that you're already so hyper attuned to, that are already scanning for, can you hold me? Like, can I do this? So it's so hard, and so much.
Yeah. And if you've had a bad experience as someone with complex trauma, I think it even deepens some of those attachment wounds, and it's reinforcement of like, no one's going to be able to hold this. So that's one reason why I think it's just so important for therapists, you know, to name, like, you actually do know and have experience with complex trauma. Because
Right.
if you don't, and someone walks into your office and you do
Oh.
and say the wrong thing, I mean, it's just so
Hmm.
incredibly harmful.
Yeah.
And me being a therapist, I believe in it so deeply, you know?
Yeah. Oh
Like I
yeah.
said, I feel like all my therapists, all my therapists
Uh-huh.
have, helped me in different seasons and helped me through different things.
Hmm.
And I will just say some of them have been. And
Yes.
so I think for me, I was like, I keep going because I'm like, I want to find that therapist because I believe in this so much and I believe in
Yeah.
it. It's so powerful.
Right.
And I could just see how someone could maybe not believe in it as much and be like, I already don't really want to do this. And then have a bad
Hmm.
experience and
Oh
just
yeah.
completely shut down and be like, I'm never doing that again. And that
Yeah.
just breaks my heart.
I know. I know. And I have seen with some in my group program and the group work, I've heard lots of examples of
Yeah.
harm done by therapists, whether it is
Hmm.
really inappropriate endings where that were not facilitated in a mindful, relational way, or a lot of misattunement, right? Of like just not
Oh,
seeing how their actions impact you. Because that, again, like with CPTSD, especially, you have to just talk. Everything has to be relational, right? It has to be, I
yeah.
understand that. And even for me going on maternity leave, right? Like I have to have the conversation and continue checking in on, I know logically you're excited, you're happy for me, right? You're happy for me for having a
Yeah.
baby. And I want to come back and just reinforce you're like, just like Brian modeled for me, you're allowed to be mad at me. Like you're allowed to be mad because I've been this consistent safe space every week and I'm going to be going away for 2 or 3 months, right? Like that's a rupture, even though the intention is not right abandonment, but it's what's happening. So like let's honor it. Like
Absolutely.
let's name it. You're allowed to be upset by that. You're allowed to have a
Yes.
complex emotion to that. Um,
Yes.
and
And that makes
so
it so much less scary for the client,
right.
just to be able to say, you're allowed to. And it would make
Yeah.
sense if you did.
Uh-huh.
And we can talk through it together. And I think
Right.
that's such an important piece of the work.
Totally. Totally. And so when a therapist hasn't maybe done the work to do that, like, or hasn't gotten to that place within themselves to know, like, because of course every therapist is different. Every therapist has different trainings,
Mhm.
different amount of experiences. And many, I think, don't have that kind of understanding of how to use the relationship and why that is so fundamental and essential with
Yeah.
clients with CPTSD.
Yeah, and that's such a good point too, because I could look up somebody on psychology today and be like, okay, they have all this training. They're trained in EMDR, they're trained in IFS, they're
Hmm.
trained in complex trauma.
Yeah.
And I get on the consultation with them and it's like, just feels cold. Right. And so
Yeah.
it's just kind of like, that's such an important piece. And you
Yeah.
can't get trained in that. Like,
No,
you
it's
can't.
so true. So
Right? Like
true.
you there
Yes.
that's like you something you
Yeah,
don't learn in grad school. Like we
it's
learn
true.
how important it is to be a human with another human,
Hmm.
but it's just sometimes you either have that or you don't. And
Or you
there's not
don't.
something you can do
I
usually to
know.
like make that thing happen.
Right.
As
Right.
parentified,
Uh,
I feel like that's why parentified children make such good therapists.
yep.
Am I
Yep.
right? Like we're
Oh
like,
yeah.
we know how to do it.
We can do it.
We've
Yeah.
been doing
But we
it
don't.
since we
Can
were like
you?
7. Yeah,
Right.
exactly.
Exactly. But I don't trust you too. It's so true.
Yes.
What's your next step, do you think?
Get your therapist's phone number.
But really, though, like for sure.
um, no, I will get his number, but I'm gonna also just keep trying.
Yeah.
And I think the biggest thing for me is that I just don't want to feel this sense of urgency.
Sure.
And I don't
Hmm.
want to just say, like, I'm going to begin this relationship, even if I don't necessarily feel like you're a good fit, because I think I've done
Hmm.
that quite a few times. And I think
Yes.
it actually has been hard because it is hard to break up with your therapist.
Yeah,
Like
for
I'm a
sure.
therapist and it's hard to break up with my therapist. And there's been
Yes.
times where I've ghosted therapists. I've done it, guys. So if you feel bad about it, it's okay. I have a therapist and I've ghosted therapists.
Hmm.
I
Sure.
have, had to just like send them an email, but I just feel like every time it leaves me this like pit in my stomach.
Yeah. Yeah.
And I think that's the other part about being a therapist. and trying to find it is because it's like I feel like I've been super vulnerable with you. Now am I going to bump into you at a networking event?
I
Like
know.
I'm going to feel
Right.
like you know all these
Mm-hmm.
intimate details about my
Sure.
life, and now
Right.
like here we are, you know,
Mm-hmm.
at this
Yes.
conference. And so I think that that's the other piece. So I think what my whole thing is I just need to like slow down
Mm-hmm.
and just have faith that the
Mm-hmm.
therapist will come. And
Yeah.
I just need to
Right.
keep
Right.
trying close on. Like
Totally.
I feel like I was thinking about it yesterday and I was like, I feel like I've been trying to make these Old Navy jeans work. That I'm just like,
Yeah.
I hate these. No offense against Old Navy. I'm sorry. I have
Totally.
don't sue me. But like, I've been
Right.
like, okay, I can put them on. I don't love them, but I also don't
Mm-hmm.
hate them. And
Mm-hmm.
okay, I'll wear them. They're uncomfortable, but I'll wear them. When like my Judy Blues or like my Made Wells are out there
Mm-hmm.
somewhere, and I like
Yes.
just haven't found them.
Find
And
them
so I feel
yet.
like that's what
Yeah.
finding a therapist should feel like. Like it's like trying on
Totally.
jeans and you want to find your perfect jeans. You don't want to
Yeah.
feel uncomfortable. You don't want to feel like you can barely breathe in them.
Right.
You don't want to feel like they make your butt look
Yeah.
fat. Like you want to feel comfortable
That
and
exactly.
good.
Comfortable. Exactly. That you can move freely and not feel constricted. And
Yes.
yes. And so I even tell people too is, really like in bringing up your biggest concern, right, on a consult call of like, how do you like, what is important to you in navigating clients who have CPTSD? Right. Like getting to like
Oh, that's a
really,
good question. I love that, Megan.
yeah,
Thank you
like,
for giving that to me. Okay. Yes.
yeah. And,
I'm going to use that one.
and even like being able to like go in to say, here's my concern. Like I've had therapists who've been fine, but also really not gotten me before. And so I have a hard time trusting. Why should I trust you? Something like that too.
Oh,
Sorry,
jeez.
I'm throwing some very
I'm
relational
imagining
questions your way.
I'm imagining getting that question as a therapist. Like I would be like,
Yeah.
oh, geez. Oh, yeah.
Uh-huh. Yeah. And right. And like I imagine the
Yeah.
answer would be like, yeah, I like it's hard to trust. And I would only expect you to come in with your guard up. Because if you have, right, if this is your history, like absolutely it's gonna be tough to trust me. And it's gonna take some time. And, like I think those kind of answers, right? Like to that kind of question could be really telling too. If someone's gonna be able again, because that's you saying, can you hold this? Can you hold this space? So
Absolutely. Yeah.
yeah,
That's a good one. Cause I did
yeah,
say, like, in one of my consultations, I was like, so how do you feel like you would work with me? Like, what are some
yeah,
things that you feel like would be important for us to do work on,
yeah.
with having
Mm-hmm.
complex trauma? And I think she said something along the lines of, well, like, I think I would just move really slow and, take into mind the relationship part that, like, you have to build this relationship. And
Mm-hmm.
I liked that answer.
Mm-hmm.
And at the same time, I was just like, I don't know. Like, that's not
Yeah,
enough
yeah.
either.
Didn't
Like,
feel
yes,
yeah.
go slow is important. And
Sure.
but maybe my expectations are just too high too. Maybe I'm like imagining that I'm just gonna like click with this therapist and we're just gonna be
Well,
like the best work together ever.
I think listening to because your nervous system knows, right? Like your nervous system
Mm.
knows, even if that was like a fine enough answer, still it didn't land as the most aligned one for you. So
Yeah, it was an Old Navy Jane's answer and not Judy
yeah,
Blue's answer.
exactly. There you go. Exactly.
Yes. Oh, I
So
love that. Okay, yeah.
yeah.
Yeah. And
Oh
I think that's also so important just for anybody listening who's trying to find a therapist as
yeah.
well, is just like being able to know you can trust your nervous system.
Mm-hmm. Mm-hmm.
And it's so important
Yep.
to do that. And I needed that
Yeah.
reminder for myself because I think what comes up for me is that I guess I go back into that there might be something wrong with me,
Mm-hmm.
and I'm
Exactly.
curious if anybody else feels like that. Like if you can't find
Oh
a good
yeah.
therapist, it's
Right.
because
Right.
there's something wrong with me. I'm just not
Yeah.
cut out for this. I'm just not cut out for therapy.
And such a good reminder that like in this, right, finding a therapist in dating, that it's
Oh,
you're looking for
yes.
the most aligned fit for you. And
Yeah.
that like that shift of like, no, I am good enough as I am. right? And I'm just looking for the person who's most aligned for me. And not everybody, right? They could have the best resume, the best Psychology Today profile, and they might not be the best fit for me, and that's okay. But then like sitting with the frustration of it's taking a long time. I hate this. And I'm waiting for the most aligned fit. I feel like there's still so much even more to talk. I'm sure we'll continue on about this Amber finding a therapist journey. I will love to check in on it next time to see how it goes.
Yes.
And if anything came up for you in listening to this, any questions you have for us, please send them our way at we should talk _pod. And we would love to hear from you. But we're going to end today with the things that we're loving this week. So what are you loving, Amber?
So with my stress levels, and with my dermatitis back, it had gone away. Like, I have really been just trying to be super intentional about calming my nervous system. And as you know, I like to watch a lot of Dateline NBC and a lot of murder. And so something my husband and I have been watching lately is The Four Seasons, which, have you watched it?
I have, but I haven't watched the most recent season.
Yeah. So I hadn't either because I watched the first season and loved it, but I love Steve Carell so much. And I was just kind of like, I don't feel like it's going to make it without him. But so we've been watching the second season together and we haven't found a show together that we liked in a really long time. Yeah. So we've been watching that and it's just been such a relief just to crack up at night and just be laughing and, laughing together. Oh, so that's what I've been loving this week. It's been getting me through.
Yeah. Oh, so good. I love that so much. And it's a good reminder that I think I'm in need of a show. And it's a good reminder that that's one I have not watched. So I'm going to put that on my list.
It's really
I also have some friends who have requested we talk about Yesteryear, which I have not read. I don't know if you've read it.
No, I haven't. I
know there's been a lot of discourse around it. So maybe we'll see if we have time in our busy schedules to add that into our conversation. For me this week, I think to me the biggest thing is like actually just allowing myself to receive help. And because I naturally want to just do it all, I think physically I'm feeling like I know that I can't. And so I've really carved out space to accept help, ask for help, give myself more time and space to take pauses and breaks and rest and do what my body and my emotions need right now. So that's going to be what I'm loving this week is just receiving help.
I love that for you too. Yeah. Especially, you're super pregnant and you're going to have two kids here pretty soon. I think that's been one of the biggest lessons for me in motherhood is just like asking for help is such a gift. It's so hard to do at first when you're, when you have been so used to never doing it and being hyper independent, but it's literally the best gift we can give ourselves. And so I love that for you. I'm so happy for you.
Thank you. Gonna keep holding on to it and reminding myself it is a necessity right now. So
absolutely. Okay. Yeah. Well, so good talking to you.
So good talking to you. As always, such a great chat. And I will look forward to seeing you and everybody next week.
Yep. See you next week.
See ya.